In this class, we will see new chapter, that is reproductive health. Let's see reproductive health. It is generally defined as health and proper functioning of all the reproductive organs and covering all the reproductive aspects. According to WHO, that is World Health Organization, reproductive health means a total well-being in all aspects of reproduction, that is physical, emotional, behavioral and social. Next, we will see the factors required for the improved reproductive health of society. They are better awareness about the sex-related matters. Then, increased number of medically assisted deliveries and better postnatal care, that is after birth care. Next is better detection of STDs and cure STDs. Overall increase medical facilities for all sex related problems, etc. Let's see the measures taken for awareness of reproductive health. India was amongst the first countries in the world to initiate to the program of family planning launched in 1951. The program were improved and covered reproduction related areas under the popular name reproductive and child health care programs. This was launched in 1997. Next, let's see the major objectives of this program. To create awareness among people about various aspects and maintain a total well-being of the reproductive organs. Next is introduction of sex education in schools and colleges. This is another step to provide right information to the youth. Sex education saves the young people from misconception about sex-related issues. Next is amniocentesis. It is a fetal sex determination test based on the chromosomal pattern in the amniotic fluid surrounding the developing embryo. It is due to determine the sex legally should be banned as it increases female feticide. Then governmental and non-governmental agencies have taken various important steps to create awareness among people about reproduction related aspects. Next heading is population explosion. Population explosion means significantly improve the quality of all life of the people. It occurs due to increased health facilities and better living conditions. The main reasons for population explosion are rapid decline in death rate, maternal mortality rate, that is maternal death due to birth or pregnancy, and infant mortality rate, along with increase in population of reproductive age is the main reason for population explosion. Let's see the steps to overcome population explosion are one by one. First is using various contraceptive methods, educating people about demerits of large family, then increasing the marriageable age group of male and female, providing incentive to parents having one or two children. Next is contraceptive methods. Already you know the meaning of contraception. That means nothing but birth control only. Contraceptive methods are used to prevent the unwanted pregnancy and modifying menstrual cycle. An ideal contraceptive should be user-friendly, easily available, effective, reversible, no side effects, no way interferes with sexual desire and sexual act. Let's see contraceptive method. Contraceptive methods are divided into the following categories. They are natural or traditional methods, barrier methods, IUDs, oral contraceptive methods, implants or injections, emergency contraceptives and surgical methods. Let's see one by one. First one is natural method. It is otherwise called as traditional method. This method helps to avoid chances of ovum and sperm meeting. It includes periodic abstinence, withdrawal or coitus interrupts, and lactational amenorrhea. Let's see one by one. First is periodic abstinence. In this, the couples avoid coitus from day 10 to 17 of the menstrual cycle. In this time only, ovulation could be expected as chances of fertilization are very high. So only this period is called as fertile period. Second one is withdrawal or coitus interrupts. In this, male partner withdraws penis from the vagina just before ejaculation to avoid insemination. Next is lactational amenorrhea. Here the name itself coming, that is lactation period. In this period, no ovulation, chances of fertilization is nil. Main advantages of natural methods of contraception is no side effect. Disadvantage of this method is chances of failure also high. Not 100% assurance as this depends on chance. Next is barrier method. This is another one method of contraception. In this method, ovum and sperms are prevented from physical meeting with the help of barrier. First one is condoms. This one is considered as mechanical barrier. Both male and female followed this one. This device is made up of rubber or latex sheet used to cover penis or vagina and cervix of female. Mainly, it helps to prevent from STDs. Next is diaphragm, cervical caps and walls are also barrier made up of rubber that is inserted into the female reproductive tract during coitus. Then the next is chemical barrier. They are spermicidal creams, jellies and foams are usually used to increase the contraceptive efficiency. Few advantages are there by using barrier methods. They are disposable, they can be self-inserted, they are reusable, they are also prevent contraception by blocking entry of sperm through cervix. Next is IUDs. IUDs means intrauterine devices. These devices are inserted by doctors or expert nurses in the uterus through vagina. They are of the following types. They are first non-mediated IUDs. Example lips loop. Copper mediated IUDs. Example CUT, CU7 and multi-load 375. And the hormone releasing IUDs. Progestastat, LNG 20. Let's see how IUDs prevent the contraception. IUDs increase the phagocytosis of sperm in uterus and copper reduce the motility and fertility capacity of sperms. The hormone releasing IUDs make the uterus unsuitable for implantation, the cervix hostile to the sperms. It is ideal for female who want to delay pregnancy and spacing between two children. Next is oral contraceptives. These are progesterone or progesterone estrogen combination used by females in the form of tablets. They inhibit the ovulation and implantation as well as change the quality of cervical mucus to prevent the entry of sperms. Let's see implants or injections. These are effective for longer. This mode of action is similar to oral contraceptives. Progesterone alone or progesterone with the combination of estrogen are used by females as injections or implants under the skin. Next is emergency contraceptive. Even this also progesterone or progesterone estrogen combination within 72 hours of coitus. It is found to be very effective. This contraceptive method helps to avoid possible pregnancy due to casual unprotected intercourse. Next method is surgical method. It is also called as sterilization method. It is used as terminal method of contraception in males and females to prevent any more pregnancy. Here We will see surgical methods of vasectomy and tubectomy. First is vasectomy. Vasectomy is the surgical method in males. Here, a small part of the vas deferens is removed and tied up through a small incision on the scrotum. This prevents the release of sperms. Next is tubectomy. Tubectomy is the surgical method in females. In this, a small part of fallopian tube is removed surgically. These techniques are highly effective, but their reversibility is very poor. By using contraceptive methods, people are facing so many side effects. Let's see one by one. The selection of contraceptive method should be taken under the consultation of doctors. They have ill effects like nausea, abdominal pain, breakthrough bleeding, irregular menstrual cycle, or even breast cancer. Let's see medical termination pregnancy. Medical termination pregnancy means voluntary termination of pregnancy before full term. Role of this is decreasing population by aborting unwanted pregnancy. In India, MTP is legalized in 1971 with some restriction to prevent its misuse such as indiscriminate and illegal female feticides. MTP is used to get rid of unwanted pregnancy due to unprotected intercourse or failure of contraceptives used during coitus. When pregnancy continuation is harmful for both mother and fetus, MTP are considered relatively safe during first trimester. That means first 3 months of pregnancy. Second trimester, MTP are much more riskier.